Hello there, this is Applied Psychology BTEC. This is Unit 3 and Content Area C2, Treatment and Management of Addiction and Stress. And in this particular video we're looking at psychological treatments for addiction, in particular cognitive behavioural therapy, which I'm sure you'll be happy about because we're very familiar with it. So, cognitive behavioural therapy, as a quick recap, what does it involve? The cognitive element, if you remember, that's to do with our thought processes, and in terms of CBT, it's all about changing the irrational thinking that is underlying the addiction. You can be applying what we know about how CBT is used in depression to what we know about addiction. Behavioural element of CBT is where you learn. Remember, the behavioural approach is all about learning and unlearning things. So the behavioural element of CBT is about learning to avoid high-risk situations and to cope better in them. So changing your behaviour. Okay, here's the processes that are involved in CBT, particularly where we're looking at addiction. So, first of all, functional analysis. This is, again, similar to depression, but you just tailor it for addiction. So you're identifying, first of all, which distorted thoughts and irrational beliefs are triggering your addictive behaviours, identifying them, and then in the next stage, what you then do in cognitive restructuring, you're going to challenge them and try and replace them with more helpful thoughts and more helpful, more rational beliefs. That hopefully are not going to lead you into this, whatever your addictive behaviour is. And then what that then leads to is behaviour change, where you're practicing skills in your therapy sessions and also in your homework tasks. And you might do that through role play, or it really depends which skills you have, which skills you're learning as part of your therapy. Because as you know, CBT is a really flexible approach. The therapist will basically have a toolkit that they can choose from and decide which particular things are needed for which particular client, choose those and work on them. Stuff like anger management, social skills, various other things. So they'll choose whichever ones are most relevant and practice them both in therapy and by setting homework tasks. The fourth process in CBT is where we're looking at relapse prevention. This is the bit that's probably a bit different from what you were expecting from when we looked at it in depression. Relapse prevention, this is all about identifying anything that's likely to make them relapse, and basically dealing with those triggers. What's going to happen when you face this trigger? What irrational thought might it trigger off in your head? Can we replace that with a more rational one so that you're not going to relapse just because you're in a particular situation? So it might be possible to remove you from the situation, but if it's not, then how are you going to cope with that situation and not resort to your addictive behaviour? So if you haven't already opened your textbook for this, it's page 92 and 93. I would recommend that you actually pause and have a read in your textbook before you carry on. There's quite a nice example about someone going to a party who's trying to give up alcohol at the bottom of page 92. So have a bit of a read of that before you carry on with this video. Okay, let's look at strengths and weaknesses then. There's lots of evidence that it's effective. So one example that we've got here is this McGill-Ray study, which again you can read about in your textbook, but basically they're comparing, they've done a big review of lots of different studies where there was a group of people getting CBT and a group of people not getting CBT, and where they've compared it. And they found, having reviewed all of these studies, that there was a benefit in having CBT. And that's quite a nice bit of evidence because it's taking loads of different studies into account. It's not just one study where they've said, oh, CBT is better, because there might be a flaw with that study. But what it's actually doing is looking at all the studies. And so that's quite a strong piece of evidence. The other strength is that last step that's built in, the relapse one. That's a really good thing to identify before the fact what might end up causing them to relapse, and giving them tools that they can use against it. So it's anecdotally, it's really effective at actually preventing relapse. However, the confusing thing about that is that when people have tried to do experiments to prove that it's effective in the long term to prevent relapse, they haven't been able to find it. So this is one of our weaknesses. That McGill and Ray study, this one here that we looked at for strengths, they did find a benefit for CBT. However, what they found was that the effect, that benefit, basically tailed off after a year. So once the year had gone by, they found that basically it was the same between CBT and a control group. And there's another study by Cowlishaw that found there was no difference, again, after a year between CBT and control groups. So that's a bit confusing, especially since lots of people are saying, well, it's really good for not relapsing. Why isn't the evidence actually finding that as well? That's a big question mark. The second problem is that actually it's too flexible to evaluate, and this is something I think we talked about when we looked at CBT and depression, is that actually it's got so many different things involved in it, loads of different techniques and different stages, and yes, it's working, but what is it about it that's working? Which part? Is it the cognitive part? Is it the behavioral part? Is it just one of these techniques that's being used in the skills training? Is it the cognitive restructuring that does it? When there's so many different elements involved in it, it's really hard to actually work out which bit is what, or what part of it is being effective. So that's a big question mark. It's a bit complex. So there you go. That's CBT in a nutshell for addiction.